This video will provide you with instructions for use of the BeneHold Tube Fixation Device, including key features and a step-by-step overview of site preparation, application, and removal to support your day-to-day use of the product. The Avery Dennison BeneHold Tube Fixation Device allows universal fixation of a wide range of tubes, lines, drains, and cords. The hook and loop closure system can accommodate lines of varying sizes in one device. Clinicians can choose from two sizes and opt for temporary fixation of tubing to allow movement and repositioning, or permanent fixation using the built-in adhesive zone. The skin-friendly hydrocolloid adhesive enhances patient comfort and helps minimize skin breakdown. The BeneHold Tube Fixation Device is intended to adhere to the patient's skin and to secure and position tubing and lines. Additional uses include positioning of cords used during medical procedures. The BeneHold Tube Fixation Device is designed to address key user and patient needs based on input from clinicians like you. The following are key features and benefits that can help make your work more efficient and the patient's experience more comfortable. The BeneHold Tube Fixation Device's simple bandage design is easily applied to the patient's skin and can be placed on the surface of the skin. The hook and loop closure system is easy to operate with gloved hands and can organize multiple tubes within one device. Hook and loop access to tubing and cords allows easy repositioning without removing tape or adhesives. The closure system can be opened and secured repeatedly without damage to the device or the patient's skin, enabling extended wear and reducing the need for repeat taping. Tubing can be permanently secured by exposing the adhesive zone in the fixation area, or the adhesive zone can remain covered for temporary securement to allow tube movement. The adhesive used in the fixation area is formulated to prevent residue buildup on tubing. The gentle yet strong adhesion of the hydrocolloid adhesive is ideal for fragile skin, helps reduce skin maceration, and provides low trauma removal. It is highly conformable and acts as a cushion against the skin. The highly flexible hydrocolloid adhesive is combined with soft, non-woven materials to reduce skin irritation. The product design allows fixation of tubing to the body without straps or clips and lifts lines off the skin to help prevent pinching or pressure points. The hook and loop closure system supports repositioning of tubing without removal and reapplication. The BeneHold Tube Fixation Device is individually packaged and gamma sterilized and can be used in sterile environments and surgical fields. To start, prepare the site according to facility protocol. Ensure the skin is clean, dry, and free from detergent, moisturizer, and cream residues, which can interfere with adhesion. If using a skin prep or protectant, ensure that it dries completely before applying the tube fixation device to ensure optimal adhesion and help minimize skin irritation. First, remove the BeneHold Tube Fixation Device from the sterile pouch. Release the hook and loop tab. Peel the device off of the liner, exposing the adhesive surface. Place the BeneHold Tube Fixation Device onto the skin. Firmly press down on the device and then smooth it into place. To allow for repositioning and some movement of tubing, release the hook and loop tab and place the tubing in the center of the BeneHold Tube Fixation Device. Close, but do not stretch, the hook and loop tab over the tubing to secure. For permanent securement of tubing to prevent movement, open the hook and loop tab and then release the film tab in the center of the device to expose the adhesive zone. Place the tubing in the center of the adhesive zone, then close, but do not stretch, the hook and loop tab over the tubing. To remove, gently pull up the corner of the BeneHold Tube Fixation Device and slowly peel it from the skin. To minimize the chance of skin trauma, pull the device back over itself and not up from the skin. If needed, medical adhesive solvents can be used to help remove the tube fixation device. Store the BeneHold Tube Fixation Device in a cool, dry place. The product expiration is 3 years from the date of manufacture. Please refer to the expiration date printed on the box. Do not stretch the BeneHold Tube Fixation Device before applying it to the skin. Applying the device under tension can cause trauma to the skin. To ensure adhesion and help prevent skin irritation, remove detergent residues and allow all skin preparations and protectants to dry completely before applying the device. Prolonged exposure to water may affect adhesion of the device to the skin, reducing the wear time. Discontinue use if an allergic reaction occurs. Do not re-sterilize the BeneHold Tube Fixation Device. The BeneHold Tube Fixation Device should not be reused. As with all adhesive-based products, adhesive effectiveness and functionality can decline after the first use, and the product will not perform as specified. Thank you for your time today. Please contact us with any questions or comments you may have on the BeneHold Tube Fixation Device, and we will be happy to help.